Good morning, everyone. Thank you so much for joining us this morning for our second day of the CPAT Symposium and our second wellness session. I'm thrilled to introduce Dr. Wendy Harpham, who is an internist, a cancer survivor, an author, and a longtime friend of NCCS. She also is from my hometown of Dallas, where she's coming to us from her husband's office this morning. She had a technical issue and did a quick change of scenery. So thank you so much for doing that, Wendy. So Dr. Harpham is going to talk to us about the benefits and limitations of visualization as a supportive therapy during treatment, recovery, and long-term survivorship. Thank you so much, Wendy, for joining us. And now I'll turn it over to you.
Good morning, everyone. Oops. Hold on one second. Well, there we go. Can you see me? Are we good?
Yeah. Yes, you're good.
Okay. Good morning, everyone, and thank you, Shelley, for the introduction. I really do feel honored to participate in this event because since my diagnosis in 1990, NCCS has made a huge difference in helping me make my life the best it could be. Shelley asked me to discuss visualization from my perspective as both a physician and a long-term cancer survivor. And she knows that from both sides of the stethoscope, I have experienced the power of visualization to help patients get good care and live as fully as possible. But first, in the tradition of speakers who share personal travel photos, here's a picture from a short trip I made just a few days ago to my husband's family cottage in Canada. Oh, wait a second. Canada, the border's closed. Yeah, that's true. But it didn't keep me from traveling to Oak Lake in my mind while I was undergoing an MRI to help. It helped me hold still, and it helped me rein in my imagination about what my new symptom might be. My goals for today's presentation are to review what visualization is, how it works, its power, and its limits, to share some illustrative stories of how visualization has helped me and might help you, and to make the case for giving visualization a try. And first, a brief review of my story. Rewind to the late 1980s. I was young, healthy, happily married, building my family. Darn cute kids, don't you think? And I was building my solo practice of internal medicine. In my work as a clinician, I embraced the notion of the mind-body connection. I mean, nobody had to convince me. Just thinking about slicing and squeezing a juicy lemon, let alone the idea of biting into one, makes my mouth water. I occasionally recommended visualization for my patients with phobias, anxiety disorders, or pain worsened by tense muscles. And those prescriptions were always in the context of referrals for counseling or biofeedback. Meanwhile, back then, the 1980s were seeing a cultural revolution of patient empowerment, which as a physician, I welcomed. I loved caring for patients who were informed and proactive. Unfortunately, mixed in with the explosion of useful resources and sound information for patients was a misguided message in the self-help literature. Mega selling authors were telling cancer patients that they could cure themselves by visualizing their immune system destroying their cancer cells. Well, I lumped that idea with nonsense cancer cures and dismissed them all. My understanding of the mind-body connection was that the mind affects the body. It does not control the body. And I saw my job, the physician's job, as providing science-based therapies with compassion. So when I celebrated my 36th birthday in 1990, I was finally living my professional and my personal dreams. My children were 1, 3, and 5 years old and doing great, and my practice was thriving. Just a few weeks later, I was diagnosed with a type of lymphatic cancer with no known cure. Now, as a patient, visualization was just not on my radar. I focused all my attention, put all my energy and my hope into the new intensive chemotherapy regimen my oncologist prescribed. And my faith in science-based therapy was reinforced when my post-treatment scans showed complete remission. Then, just before my first one-year checkup, my cancer recurred, and my oncologist prescribed radiation therapy. Now, for sure, I was very distraught about my diagnosis, but I had absolutely no concerns about my first radiation treatment. I expected it would be like having my picture taken. The technician, because it was head and neck, the technician immobilized my head in a custom-made plastic mask that tethered my head to the table. Then she left the room. That thick door clicked closed. A square of light radiated onto me, accompanied by a buzz. After 30 seconds or so, the skin of my neck got warm. And I thought, hey, what's this? I'm not supposed to feel anything. So I paid more attention. Yeah, my skin is definitely warm and it's getting warmer. The treatment ended. And on my way out, I passed my radiation oncologist who asked, how'd it go, Wendy? I said, well, it was fine, but I was shocked my skin got warm. I was expecting to feel nothing. His response was immediate and matter of fact. Your skin wasn't warm, Wendy. You imagined it because you were afraid. What? I imagined that? Well, first of all, phew, thank goodness they hadn't goofed and zapped me with way too much radiation. But I imagined that? No way. That warmth was real. Over the next few hours, memories started emerging that might explain my supposed fear of radiation. You know, in elementary school, we did drills where we hid under the desks for nuclear air raid drills. As a teen going to the dentist, I remember feeling the weight of the lead apron on my budding breast while listening to the buzz of the x-ray machine. And during my medical training in the emergency room, I remember hurrying to a safe distance after comforting a patient who needed to be positioned for an x-ray. Could I have a long-standing fear of radiation expressing itself in symptoms in neck warmth during my radiation treatments? The next day, the technician strapped me down, the thick door closed, click. Again, I watched that square of light as I listened to the buzz, wondering what I would feel. Nothing. Absolutely nothing. The buzz stopped, the session was over, and I was amazed. Not that my fears had caused physical symptoms the day before, but that I had undervalued the power of the mind and had been neglecting an opportunity to channel it toward my healing. You know, if my mind could make me feel warmth, then my mind could help me feel hungry after chemo and help lessen my neuropathic leg pain. Well, for the rest of my radiation treatments, I visualized the gamma rays killing my cancer cells. I visualized my healthy cells finishing clearing out the dead cells. And those mental images calmed my fears of radiation. They helped me feel less vulnerable and more empowered. Visualization, visualizing those positive images helped me do what I needed to do that day to get well. And over the years since, a variety of visualization techniques have helped me through the many challenges of my survivorship. So let's get to the heart of the matter. What is visualization? Well, we all visualize all the time. I mean, it happens naturally while we're planning a surprise party, making dinner reservations, waiting for a loved one at the airport, waiting for a call from the doctor's office. Visualization refers to something different. It is a skill. It's a learned and practiced technique of focusing attention to consciously create a mental image, a picture in your mind. Common images for visualization include a landscape, a still life, a shape, a color, just a splash of color, a design like a helix or something spinning. It can be the image of you striking a pose or doing some activity. How does visualization work? It taps into the mind-body connection, the connection that causes our mouths to water when we simply think of biting into a lemon. And that mind-body connection is likely mediated by the nervous system, namely the brain, the spinal cord, and all the big and tiny nerves throughout your body that modulate the other systems of the body, such as your blood vessels, your muscles, your glands that produce hormones, and so on. When I envision a squirt of sour lemon juice, my brain sends signals via the nervous system to my parotids, the salivary glands, and trigger a measurably watery mouth. During and after cancer treatments, patients can leverage this mind-body connection by conjuring images that influence their physical and emotional reactions to what's happening now and what's going to happen. What you experience at any moment in time is the result of all the various signals in your brain. It's a reflection of the pattern. Your experience reflects the pattern of brain cells that are triggered, that are activated. And some are activated because of signals coming up the body from your sensory organs, your eyes, ears, nose, mouth, skin. Some started in the brain, and most of them you have no control over. Well, visualization is a way to voluntarily add signals to the mix. Signals that may modify some of the other signals in the brain. With visualization, patients benefit if by adding a mental image, it changes the sum total of signals to make your experience better in some way. Well, this oversimplification of how visualization works highlights a basic truth. The mind affects the body affects the mind. How we think affects how we feel, and how we feel affects how we think. For example, if a car in front of you veered off the road and crashed into a tree, suddenly your pulse and your blood pressure might go up, and you might feel like you just drank 6 cups of coffee. Seeing something affected how you felt. Now imagine you're lounging by a pool, you have nothing to worry about, and you drink 6 cups of coffee. Your blood pressure and your pulse may go up, and you may feel anxious. The body affects the mind. Well, how might visualization help patients leverage this mind-body connection to their advantage during and after cancer treatment? Regarding physical benefits, one way visualization might help is by facilitating compliance with effective therapies that work best when taken properly and on schedule. As an example, for a patient who has fear of treatment's toxicity, that patient may be tempted to delay making a treatment decision or delay starting therapy. Visualizing chemo or radiation or immunotherapy as healing light or as armies of cancer fighters may help calm those fears and empower the patient to proceed. For patients struggling with the demands of physical therapy or voice therapy or some whatever therapy, visualizing themselves doing the activity that's expected to be possible again may help motivate them to proceed with the needed therapy. And in those cases, visualization is helping physically by helping patients do what is needed to be done to help improve the outcome. Another way visualization may help physically is by helping increase physical reserves. So let's say you have a poor appetite. Envisioning food as healing medicine or healing fuel may help you overcome the nausea enough to take in calories. Sleep difficulties are a very common issue during and after cancer treatment, and they really can wear down physical resilience. It affects immunity and all these other things. Throughout the early years of my survivorship, I struggled with very disordered sleep because of pain and hormone-related sleep issues and medications. And visualization was one of the tools that helped me sleep better, which helped me feel better. Another way visualization may increase physical resilience is by decreasing stress hormones. Distress of any sort triggers physical changes that include elevated stress hormones like adrenaline. Short term, those changes can make you feel worse. Long term, chronic stress can cause harmful physical consequences. So visualization is one tool that may help by helping lessen the stress response. An example of visualization decreasing short-term stress is for patients who get anxious while undergoing needle sticks. Many patients find that simply visualizing a calm scene helps decrease that immediate stress reaction. A longer-term stress situation common is where tumor pain is causing the natural reaction of tensing up the surrounding muscles. Well, muscle tightening, muscle spasm can worsen pain, which can increase anxiety, which can increase your stress, which can increase the muscle tightening, and so on. Visualization can interrupt that cycle. Visualization designed to help patients relax the muscles near the tumor may experience some pain relief, which decreases their anxiety, which further relaxes their muscles, and so on. And over time, less chronic pain can mean less chronic stress affecting your body in negative ways. Well, for me and for many others, surviving cancer can be as much an emotional as a physical challenge. Tapping into the mind-body connection with visualization may also preserve emotional reserves and build emotional resistance by decreasing emotional distress, by facilitating restorative sleep. And I mentioned mood because visualization helps mood if it helps improve your perception of what's happening, if it helps improve how you feel about yourself. And both of those can help with optimism and hope, which optimism and hope help lift mood. You know, I'm going through something right now, and when I visualize myself as strong, I find myself feeling more hopeful of getting through to a better tomorrow, which helps my mood. I also mentioned visualization designed to foster feelings of kindness toward yourself and toward others. And that helps by leading to improved self-image, self-confidence, and improved relationships. All of these measures can increase a sense of control. And control is a huge issue in survivorship, which takes me to the potential dangers of visualization. Visualization has no side effects or after effects. It is safe unless belief in the healing powers of visualization keeps people from effective therapies, such as if patients delay or reject effective cancer therapies and instead try to visualize away their tumors. Unless patients with severe cancer pain try to manage it solely with visualization and deprive themselves of the benefits of effective pain medicine and interventions. Another danger can arise in patients who have enjoyed a sense of control and symptom relief with visualization and then suffer a medical setback. They may blame themselves as if the setback is somehow their fault. Setbacks and recurrences don't happen because patients didn't visualize right or visualize often enough. They happen because modern medicine needs better treatments for many conditions. And the third danger is it can be a problem if patients try it and don't like it. It's just not for them, but they feel obligated to do it because they keep hearing how great it is. They feel they're supposed to do everything to try to fix their cancer, or because a loved one is pushing them to do visualization. It's not for everyone. If you try it and it's not for you, or you don't like doing it, that is a-okay. There's nothing wrong with you, just let it go. As for how to learn how to visualize, the great news is you don't have to start from scratch the way you would if learning a totally new skill like caring for a PICC line. You know how to visualize. Your mind is wired to visualize. The technique of visualization builds on that. You learn to find a useful image and to focus your mind on the image that works well for you. And the basic idea of visualization is to get settled in a nice, quiet place, to take some slow cleansing breaths, and that helps you focus. And then you recreate in your mind the sights, the sounds, the smells, the sensations, the tastes of a specific image. I list 3 resources. There are a lot of local and national cancer support organizations that offer free classes and online resources. Many counselors are trained to help teach patients how to visualize, social workers, psychologists, other counselors, or they can refer you to professionals who do. And of course, books, articles, audio tapes, websites. And I'm going to keep repeating that whenever you're using self-help resources, keep in mind that anybody can say, I'm an expert. So just beware of false claims of curing cancer with visualization. A lot of people ask, well, what image should I visualize? The best image for you depends on what you hope to achieve by visualizing and which image works well for that purpose. So if you need distraction from stressful situations where you have a passive role, like having a needle stick or an MRI, a calming image may work. And again, only you can know what's calming for you. You may need a more active image. And then again, you may benefit from a mix. This week, while I was lying on that MRI scanner for a long time, I'd asked the techs to put on my headset classical music because I was going to use that to help me visualize. And when the music was soft and undulating, I visited my family cottage in Canada. At one point in the scan, the MRI sequence had just some really loud banging that drowned out the music. So I switched and started envisioning myself jogging up and down some hills. And too bad my cell phone didn't include that jog in my daily step count, but it made me feel empowered and helped me hold still during the MRI. Now, another use of visualization is to muster motivation to do what you know you need to do. Just imagine patients who are just worn out from months or years of cancer therapy, and they may need some help mustering the wherewithal to keep going back to the cancer center for more treatment. In those cases, visualizing an upcoming event, whether a major event like a wedding or something as mundane as meeting a friend for a cup of coffee, may help. For patients who have lost some function, mobility, voice, whatever, visualizing, and it's temporary, so they're expected to recover with therapy. Visualizing themselves recovered may help them pursue their rehab with vigor. We mentioned earlier that visualization can be used to try to obtain physical comfort or emotional comfort. My point is that thinking about the purpose you want your visualization to serve in the specific situation may help you find the best visualizing image and the best technique for you. And those resources I highlighted earlier provide a large menu of various visualization techniques. So like a menu, an a la carte menu, you can pick and choose which you try for which purpose. I've spent the past 30 years exploring how patients get good care and live as fully as possible as a cancer diagnosis. And 2 key steps are nourishing hope and taking effective action. The big picture view of visualization, from my perspective as a physician survivor, is that visualization can be a useful tool in overcoming the obstacles to finding hope and taking action that you know is best, action that gives you the best chance of the desired outcome. So, to make my case for at least trying it, why? It may help. It's free, there's no insurance paperwork, there are no adverse side effects or after effects. It's portable, you can do it anywhere, you don't need any equipment, you can personalize it for you, and it's safe, with that asterisk It's safe as long as it doesn't interfere with making wise decisions, with taking proper steps, and with obtaining good care, or as long as it doesn't add stress. In order to help you manage your expectations about visualization, keep in mind it is a skill. So instruction may help, and practice can make a big difference. There is no one right way for everybody to visualize, but I do believe there are best ways for you, for the situation you're in or the purpose you're trying to have it serve. And that's why at least explore the options and see if one or more might work for you. It can be trial and error too, meaning you can try one that works for a lot of people, doesn't work for you, you try another and that works well. And the other thing is to know that an approach that works well for one situation for you may not work well for another. And an approach that works well for you at one time may not work as well for you at another time. I keep mentioning the practice, the professional guidance, and beware the false claims of curing cancer. Just stop for a second and ask yourself, is this helping me? Is it helping my physical, my emotional, my motivation, my sense of hope? Is it helping me do what I need to do? And if not, try a different approach or let it go. As both a physician and a patient, I wish I had a magic wand to swish away the pain and distress during and after cancer treatment. But that's from Amazon. Without a magic wand, I encourage you to add to your coping toolbox by learning about visualization and giving it a try. Visualization may help you find what I call healing hope, namely hope that helps you act when you can do something to improve the outcome, and hope that helps you wait when there's nothing or no more you can do. Throughout my survivorship, visualization has reminded me of Niebuhr's Serenity Prayer, because visualization has helped me accept what I could not change and change what I could. My hope is that visualization can do the same for you. Thank you. Thank you, Shelley. Thank you, NCCS.
Thank you, Wendy. That was really wonderful. I will tell you one way I use visualization is when I go to bed at night, I visualize what my workout's going to be in the morning. And that way it helps increase the chance that I get up and actually do it. But I think through, really kind of see myself going through the steps to do that workout. We have one question from the audience, and I know we only have a couple of minutes, but I think this is a really good one to address. Loretta said she's practicing mindfulness therapy, and it sounds similar. A lot of the techniques sound similar. So can you talk a little bit about the difference between visualization and mindfulness, or how do
Right.
they intersect?
These are techniques and phenomena that overlap, meaning mindfulness is heightened awareness of sensations and what's around you, and visualization is picturing a mental image in your mind. And so they are different techniques, but there is overlap because you're using your mind to imagine. You're using your mind to pay attention and picture.
Great. Thank you. That was really wonderful, and you have such a great way of delivering it, and the specific sights and sounds and all of that you bring into it really are very effective in the way you present it. But I think also something that you would incorporate into the visualization if you're doing it. So.
And Shelley, my fear is that because many people have heard of visualization and they just kind of think they know what it is, and they may like knee-jerk say, oh, that's not for me, without giving it a try. And my message is it's such a useful tool for so many people, not for everyone, but for so many people, that understanding its power and its limits, and at least giving it a try, it's one more thing that may it's one more thing that may make your journey safer, easier, happier, more hopeful.
Yeah.
So that's my message.
And it's free and easy to try. You don't have to buy anything. You don't have to, it's easy. So it's worth
And
it.
it helps beyond cancer. It's not just about cancer and survivorship. It helps with challenges and stresses of life.
Yeah. Yeah. Well, thank you so much, Wendy, for joining us. We really appreciate you and look forward to sharing this with the archive of this with anybody who wasn't able to join us live today. Thank you for all that you do to help cancer survivors have more hope as they go through their survivorship journey. All right, we'll see everybody at noon Eastern and 9 o'clock on the West Coast for the beginning of our sessions today. Thank you. Bye.